Have you ever heard of mouth taping? It's quite the trend. But is it safe? Does it work? What does the research say? Here's what you need to know. I'm Dr. Joseph Houlik. I'm a dentist and member of the American Academy of Dental Sleep Medicine. As a dentist, I see firsthand how breathing affects oral health and overall health and more. And so personally, I feel it's under talked about in our profession. And a question I've been getting a lot lately is, hey, what do you think about mouth taping? Real quick too, guys, I do my best to prepare for these videos, and it's a lot easier if I can kind of read from my script, so you might see me looking up and down. So what is mouth taping? Well, it's very simple. Essentially, you are taping your mouth shut, well, or at least partially shut, to force yourself to breathe through your nose. How it's done will vary. There are different types of tape on the market and different brands, some of which will cover the whole mouth. Others they'll want you to place them just vertically so air can still escape the mouth. And then others will cover the mouth, but then they'll have like little openings kind of by your lips so that air can still escape. Why are people like turning to it? Why is it so trendy? Well, in short, it forces you to breathe through your nose. Okay. Well, think about like that first meditation breath, or if somebody like really makes you upset or frustrates you, it's like, that's typically what you default to because you feel like that good deep breath. It's part of a growing trend of wellness and sleep improvement practices. So what's really the science behind mouth breathing versus nasal breathing? Like if we're going to tape our mouth shut, why do we even want to breathe through our nose? When we breathe through the nose, the air is being filtered to a degree. The air is being warmed and humidified. It also can increase nitric oxide, which dilates blood vessels and your airway. So all of this basically makes it easier for your lungs to absorb oxygen. Now, nose breathing also too activates the diaphragm. And so typically you can increase the amount of air that you're taking in. And so in general, it is considered more efficient than mouth breathing. There is one big assumption here too, and that is of course that you can breathe through your nose. Now, if you cannot breathe through your nose and you tape your mouth shut, then you're really going to have a problem. Now, contrast this with mouth breathing. So we just described nose breathing. Now with mouth breathing, the mouth is not being filtered. It's a little bit more dry. Typically, the breaths are a little bit more shallow. And so you kind of get this less efficient oxygenation. Now, as air is flowing through the mouth, it of course can have a drying effect, which can make you more susceptible to oral health problems, such as bad breath, cavities, gingivitis, which could lead to periodontitis. And so with heavy mouth breathers, it's not uncommon to see these types of things. And also too, it can kind of show face, no pun intended there, in craniofacial development as far as like malocclusions and just skeletal growth. And so in general, nasal breathing should lead to better oxygenation, less downsides. Now, mouth breathing, not quite as good oxygenation, and maybe some more potential for upper airway collapse or obstructions with that. So you're probably thinking, I don't know if I'm ever going to breathe through my mouth again. That's what I thought when I was making this video. What are some of the proposed benefits of mouth taping? Now, if we had two anatomically identical patients, so two patients who could breathe through their mouth and their nose just fine, if we're forcing ourselves to breathe through our nose, we're breathing more deeply, the air is better, depending on where you are, I guess. The oxygen efficiency is improved. Now, this makes sense that if we're breathing better and the oxygenation efficiency is improved, that this has the potential to improve your sleep quality, which should then improve overall health, cognitive function, focus, concentration, reduce daytime fatigue, reduce daytime tiredness, not to mention keeping your mouth more moist in a healthier environment to help fight against some of those things that we mentioned earlier. So in addition to this, in theory, we are reducing the potential for obstructions. So nasal breathing versus mouth breathing when you're sleeping. So if you think about it, it's pretty simple. Like if you're lying down, the tongue is in a more retruded position. Not to mention, as we sleep, the muscle tone in our mouth and kind of in your, I'll just call it the throat, changes, and the muscles become more relaxed through the different stages of sleep. And so as they become more relaxed, this can lead to a narrowing of the airway, which then can make it more susceptible to collapse of basically where the air is trying to flow through there. So this can lead to more obstructions when you're sleeping, hence less oxygen, hence less sleep, more daytime fatigue, other health consequences. And so versus air flowing through the nasal cavity with less changes in that type of muscle tone, less changes in the variability as far as areas for obstruction. Remember too, this is for anatomically identical patients. Now, another argument that is made for the why to mouth tape is to improve muscle memory. I mean, and this makes sense. Like anything else, the more you do it, the more likely you are to continue to do it. And so one of the arguments is mouth breathing kind of trains you to breathe through your nose more, or at least kind of get you back into the habit of breathing through your nose more. Now, the concerns about mouth taping. Now, obviously, number one, you got to make sure that you can breathe through your nose. I think the biggest concern is just listening to other people's advice on social media. That's kind of ironic I'm making this video, right? Just to remember that it's not for everyone. I think that's the biggest thing to remember, is that it's not for everyone. You can't just lump everyone into kind of one, bucket and say, hey, you need to sleep with mouth tape. It's going to change your life. Now, if you're snoring, if you're having trouble sleeping, if you're extremely tired during the day, if you have other health problems, if you have nasal obstructions, if you're chronically congested, the anatomical differences, the list goes on. Like, is taping really the best thing for you in your overall health? Well, that's debatable. If you are experiencing any of those things I just mentioned, obviously a good place to start is to consult with a doctor. Be sure to find a doctor that you trust. I would encourage you to talk to somebody who has experience with sleep, with airway, or stays up to date with research. And so that the validity of what you're asking them about, which would be mouth taping here, is not completely written off, but that you're also checking all of your boxes to make sure that you're doing what in fact will be the best for your overall health. Now, there are some other concerns as far as mouth taping. To me, these seem to be minor versus like, is this good for your health? Yes or no. Some of these concerns are, skin irritation, anxiety about wearing the tape, and other miscellaneous things. So what does the research say? If we're going to recommend something to patients, we want to, from the doctor's perspective, we want to make sure that there's evidence supporting what we're recommending. Is there any evidence out there other than online testimonials from people who, and their kind of subjective opinions? The evidence is very limited, but they have done some interesting studies that reviewed mouth taping in individuals who have sleep apnea, individuals who snore, and those who have asthma. So in 2022, Harvard did an interesting study where the main focus of the study was, does mouth breathing increase upper airway collapsibility? And it's kind of like, yeah. But what they did was they took people who were already diagnosed with varying degrees of sleep apnea. Now, remember, obstructive sleep apnea is where basically there's just an obstruction in your airway when you're sleeping, which causes problems. The patients in the study had mild, moderate, or severe sleep apnea. So they were kind of all across the board in the severity of the sleep apnea. And then they broke them up into different groups where some people just didn't have any treatment. I don't know if I want to be in that group. Some of them were given mandibular advancement devices, like a mouthpiece you wear to pull the jaw forward. Others had the mandibular advancement device with tape covering their mouth or part of it. And then others just wore tape only. Now, what's interesting is the group that had the most improvement in the number of obstructions, as far as like the least amount of obstructions, was the mandibular advancement device with tape. Interesting. So the tape did help here. There wasn't necessarily a huge change in people who had no treatment, so they had absolutely no therapies at all, and those that just did the tape. The taping did seem to help and could be a beneficial key there, for the treatment of sleep apnea, but is not a recommended standalone therapy. They also, in 2022, had another study where they took patients of just mild sleep apnea and had them use mouth tape. Now, this group was a little bit smaller, and the study had some flaws kind of in its design. And so you have to take that into consideration when you're interpreting the evidence of the study. But in general, the snoring index and the number of obstructions did seem to decrease. So, and that study did show it could potentially be beneficial also. Another study of snoring basically took 50 participants, but the downside is the tape was not used in isolation, only with other therapies like the mandibular advancement device. So you can't say all the positive results were from the tape itself, but again, it did seem to be beneficial in addition to some of the other therapies that were being used. So in summary, guys, here, most claims regarding mouth taping on social media are unsubstantiated by evidence. I will say though, if you read between the lines of the different studies, I think it's difficult to ignore or write off that mouth taping could be beneficial in particular circumstances or particular individuals. I don't know if it's necessarily a standalone therapy, but in addition to maybe some other things that you're using, such as the mandibular advancement device. So I'm sure there'll be more studies and more to come. And like anything else, the research is ever kind of evolving and changing. So it'll be interesting to see what else we find out. Some alternatives to mouth taping and other things to consider. So keep in mind, important thing to ask yourself is, why are you mouth taping to begin with? Are you just hopping on the trend, or are you looking to actually breathe better and have better overall health? If that's the case, breathe better overall health. Some other things that you could do, or at least try, other than taping your mouth shut, would be nasal dilators or strips. Some people enjoy breathing exercises, kind of more like that yoga vibe. Also myofunctional therapy, which are exercises to help strengthen the muscle tone of muscles of the face, the mouth, the tongue. That's for another video. I think a really highly underrated thing is just great sleep hygiene and routines, not on your phone, on the computer, watching TV, doing things that are, going to basically keep you awake longer or interfere with your sleep. That in general, if you're trying to sleep better, the great sleep hygiene and routines. Another thing you could do is sleep position therapy. So, laying on your back versus laying on your side. Again, another underrated thing is just great overall. If you're looking for overall health, weight. So there's definitely a clear kind of association of, if you increase basically weight, or if you become overweight, you're going to, the odds of you having sleep apnea go up. If you lose weight, the significance of any apneas decreases. So like weight is incredibly important. And in general, guys, if you're having trouble breathing or sleeping, and this is an ongoing thing, consult with your doctor. That's always the best place to start. In conclusion and final thoughts, personal opinion, on paper, it seems to make a lot of sense. Like we said, the different ideas and concepts of breathing through your mouth versus your nose. And it seems like it could be beneficial for some people. When it comes to like airway obstructions, sleep, breathing, these seem like very simple concepts, and they are. Keep things simple, but they also can be complex, and they are going to vary greatly between individuals. And so every patient is different, and every individual's like kind of unique circumstance needs to be taken into consideration as far as, is this really the best thing for me and my overall health? I do know that I will try it myself. Now, I don't have trouble sleeping. I don't really have any nasal obstructions. In general, I just think it would be interesting to try it, to see what it's like, see what it feels like, and to see if I maybe notice a difference in my energy, in my sleep, and I'll be excited to keep you guys posted on that. So as always, thank you guys for your time. If you got any value out of this video, please give us a thumbs up. Consider subscribing to the channel. Thank you for your time. We look forward to making more videos for you guys. Thank you.